It was great stuff. Okay, so we're going to talk about this for a second. Tomorrow, May 1st, and tomorrow marks the beginning of Skin Cancer Awareness Month. So it's time to raise awareness. Here with more on some of the key treatment advances on melanoma, a common but treatable cancer, is Dr. Hugh Greenway with Scripps. Good morning, doctor. Nice to have you here.
Good morning. Thank you. Nice to be here.
Well, so melanoma is the deadliest form of skin cancer, or one of the deadliest forms of skin, but it's also very common.
It is. The three main types of skin cancer: basal cell carcinoma, squamous cell carcinoma, and melanoma. And as you mentioned, May is Skin Cancer Awareness Month. Melanoma is the most deadly and the one that we really need to pay the most attention to.
Okay. And so, I mean, what are the, in terms of maybe not numbers, but I mean, are we continuing to see an issue with the number of people getting diagnosed with melanoma?
There's bad news and good news.
Okay.
The bad
Give
news,
me the bad news first.
The bad news is yes, we are seeing more and more melanoma, in part because the older adult group had grown up with sunburns. We didn't have protective measures, and so we're tending to see more of that. So we see more melanoma in young adults. It's the second incidence of cancer behind breast cancer. So we are seeing more. The good news is in children and adolescents, we actually have cut the melanoma rate in half between the 2000 early group and the 2010 to 2014.
Wow.
So
that's good.
I think a lot of that is because of parents, mainly mothers and grandmothers, are really more aware and encouraging their children and adolescents to use protective measures.
That is, and clearly these are some examples of some protective measures, right? I mean, the sunblock, the sunscreen, hats, and all of that.
Right. I think when you look, you want a sunscreen that has UVA and is broad protection.
Okay.
What I tell parents is let the child or the adolescent teenager choose their own sunscreen.
Okay.
In other words, you can't make them use the one you're using. And they come in sprays. We used to say the sprays were not very effective, but the sprays are actually really good now. And you need a hat, and sunglasses are extremely important. We do see melanoma in unusual places. I had a sister that had a melanoma of her eye and actually had to have her eye removed. So we do see that.
Yeah, my goodness. But at on the same note, the medical field has come a long way, a tremendous way in diagnosing and treating melanoma cancer.
We really have. We have a number of aids that we use to make the diagnosis early. And probably one of the biggest advances is we now have a number of drugs we call immunotherapies. Chemotherapy, we still use some, but chemotherapy goes in and attacks good cells and bad cells. Immunotherapy, we tend to target toward the melanoma. President Jimmy Carter, who had a melanoma with his brain, in addition to some surgery, underwent immunotherapy. And so that's the biggest advance I think we have in melanoma in the last few years. In terms of treatment, we used to talk to our patients about if their melanoma had spread, that the life expectancy would be months. Now we talk about it in terms of years.
How do you know if you could be at risk for skin cancer, melanoma? I mean, you know, is it a certain color type of mold? That's what I always think about.
Well, there's a number of risk factors. Your genetics, the lighter your skin, if you have light-colored hair, light eyes. Did you have sunburns when you were younger? Most ladies spent more time out in the sun and got sunburns on their backs and legs. And then family history, as we talked about, and the fact that we live here in San Diego. We love San Diego because of the weather, but we are more at risk. One of the things we will do at this summer for the lifeguards is we'll go down and screen the lifeguards. They're one of the highest risk populations we have. About half of them are part-time, so they don't have health insurance. So it's one of the community benefits that we as dermatologists at Scripps offer.
Oh, that's great. And yeah, I mean, it's pretty much sunny and comfortable for the most part year-round. But I know that also when it's cloudy, you can get sunburn.
You can.
Overcast skies.
Pay attention.
Thank you so much, Dr. Greenway. So nice to have you here. Great information, raising awareness. Remember, tomorrow marks the beginning of Skin Cancer Awareness Month, so it's a good time to be cognizant of all of the risks and what you need to do to try and prevent this. So thank you so much.
Thank you.
Appreciate it.